This film marks 20 years of the Lighthouse Trust. It is dedicated to the memory of approximately 1.5 million persons who have died of AIDS in Malawi. The film tells about some of the people at the Lighthouse Trust who have been and still are at the front line in the fight against HIV. In 1985, the first case of HIV was discovered at Kamuzu Central Hospital in Malawi. Within 10 years, 15% of all Malawians were HIV positive. AIDS became the most common reason of death in Malawi.
There is no person in Malawi who can claim that they've not been infected or affected by HIV. All of us have lost friends, have lost loved ones, have lost family members due to HIV.
I had relatives, I had my aunts, my uncles, and when I think what happened to them, I feel like crying because during that time, we didn't know what they were suffering from. But even if we could have known, ART was at cost. We couldn't manage to save their lives.
I have lost 3 sisters. I've lost a young brother. They were twins, but the other twin brother is still around. And this young brother was married. He passed on. The wife passed on. The son, he passed on. So you can imagine these are members within my family where I come from. But this happened the time before Lighthouse was there.
At that time, no treatment was available and no designated facility existed to take care of AIDS patients. In their overcrowded wards, the only thing that doctors and nurses could do was to manage death.
And in 1997, 98, 99, HIV was at peak in Malawi. It was indeed not easy. You could find the wards were full, and also the veranda were full of bed-ridden patients.
It was a difficult and hard task for me to deliver where patients are coming in thinking you're going to cure them, but you are telling them that if currently we do not have the medicine for this, what we can do is only symptom control and pain control, and also just to make sure that you are comfortable.
There was a lot of death rate which was happening in the hospital. If that day they had 6 or 7 deaths, people were happy, were saying today we haven't worked. So it was 10 and above.
In 1998, 8 health workers, among them Professor Sampiri and Ruth Amali, went on the initiative and began to organize home-based care for HIV/AIDS patients. They formed the nucleus of what would later be known as Lighthouse.
In our free time, we would go into their homes and provide the necessary psychosocial support, pain management, and treatment for opportunistic infection, and also to make sure that we see on how best they can live better, and also telling their guardians on how to manage them.
And that group was called Lilongwe Home-Based Care. We divide ourselves according to the locations which we are coming from, and told ourselves that we needed to see those patients who were discharged from the ward.
So that was the first step, that's the home-based care referral network. The second step was, well, can we set up a center where these people can go and we do all the necessary support that we can provide, even without availability of antiretroviral drugs. So with that, that's when we said, yes, we can have that center. And that center was designated at Kamuzu Central Hospital.
In the year 2000, home-based care Lilongwe moved into its first and present facility. 2 years later, it was officially named Lighthouse Trust. In 2004, free antiretroviral treatment, ART, became available. But how could one small clinic possibly help thousands of people living with HIV throughout the country?
We had only 4 rooms. So 180 people was the number to be seen. If you're outside the 180, then you would go back and come the following day. It was trouble.
We had to sit on a queue, very long queues, very long queues. As early as the 3 a.m., sometimes 4 a.m., you must report there. But the only open offices around 7:30. So you can imagine, and I still recall very well, around June, it's chilly, it's cold, there's a bit of showers there, but you find people that have already queued online.
People could come a day before to the clinic just to make sure that they are the ones to be seen on that day.
There was one thing which was dramatic that time. There was the building of the Ethel Mutarika maternity wing there. So the guards, actually that time, of the contractor, could put up stones on the queue, and they were selling those positions to patients. So if you came in around 6 o'clock, then you want to be within the 180, then these ones would say, oh yeah, there's a spot over here, and then they would sell. And people were buying a slot in order to be amongst the 180. This was really critical and dramatic, and I remember it very well. And the thing was that it got us thinking.
Endless waiting lines are a matter of the past. With help from many partners, Lighthouse has become Malawi's center of excellence for the treatment of HIV/AIDS, tuberculosis, and an increasing number of additional health-related issues. What started with 8 volunteers has become an operation with over 600 employees that keeps growing in scale and quality.
Lighthouse contributes quite a lot to the total number of people that are being treated in this country. We are seeing over 135,000 clients that are currently alive and on treatment.
Continuous technical advances have been one of the keystones to the success of Lighthouse.
Before Lighthouse established a lab, every other test that we were doing for viral load targeted could take about 3 weeks, 4 weeks for us to get the result, which meant that the patient had to wait home, even though the results were critical, for them to be managed here at Lighthouse. But with the coming in of the tests, it only takes about 2 hours. So a patient comes in and then the test gets done and the management is also done within the same day. So this aspect of giving the result within the same day has helped to improve the patient care, which has also saved a number of patients' lives.
But with all technical advances done at Lighthouse, the most precious resource is its people.
Definitely a remarkable thing here when you start working is that you don't have all these diagnostic options like CT scans, MRI scans, and what that we have in Germany. So the clinicians here, and there are some really remarkable good clinicians who work with their clinical senses, and that is something that that I had to learn again when I came to Africa.
When it started, Lighthouse was an offspring from Kamuzu Central Hospital. Today, Lighthouse staff continue to support the care of patients in the hospital wards.
Room number 5 is a room inside the medical department at Kamuzu Central Hospital, where Lighthouse staff came in collaboration with Kamuzu Central Hospital staff to help patients who are HIV positive.
But it takes more than just medical excellence to fight HIV, because the virus affects the whole community. Lighthouse has therefore established programs to address it on a psychological, social, and educational level.
A client who has just been tested HIV positive is in a shock, is in denial. Okay, not all clients that test HIV positive accept their status there and then. A good number of them struggle with the acceptance.
In the early days when HIV just started, many people were hesitant to come forward to say they're positive. And these are the phases that we've gone through. So Lighthouse broke this barrier because people were able to come forward and say, I'm positive, and I know I'm getting the treatment, and now I'll be better. And most of them are leading positive lives now because they passed through the Lighthouse.
Avoiding stigma is especially relevant when dealing with children. They make up about 10% of all people living with HIV in Malawi. Lighthouse has initiated special teen clubs to help them live positive lives.
Well, the Teen Club is what we call a differentiated care service for HIV-positive youth, so that we can give them the opportunity of living positively by enhancing their adherence and of course, disclosure.
Most children living with HIV got infected through mother-to-child transmission. Sometimes the virus is the only inheritance these youngsters got from their parents who died of AIDS when they were still small. Today, there are about 100,000 children living with HIV in Malawi. When they were young, Shiletso and Lucia attended the Lighthouse Teen Clubs. Today, they live in a suburb of Lilongwe.
I knew when I was about 13 years old that I got HIV when my sister took me to the hospital. But at that time, my sister didn't know that I was HIV positive. And my parents, all of them passed away when I was 13 years old. At that time, because people used to say that once you got HIV, that means your days are numbered, you're going to die. So I was like, oh, maybe any day I will die. But when I went to Lighthouse Clinic, the encouragement was that I should keep on drinking my medications, you'll be fine.
I was born with HIV. Yeah. And the time I knew that I am HIV positive, I want to kill myself. Just because I don't understand how come should I have HIV positive. When it happened this, my mother took me to the hospital, Central Hospital, Lighthouse. And they give me advice at the Lighthouse, give me advice that you should be alive. Don't do this.
Lucia and Shiletso met at the Lighthouse Teen Club. They became a couple and eventually got married. Lighthouse has given them a perspective and a very real outlook for a good, shared future. They even have a son called Gospel. Thanks to the antiretroviral treatment his parents receive, Gospel is HIV negative and lives a normal life. Not all orphan stories in Malawi are that lucky. When there is no family left to take care of HIV orphans, Lighthouse sets up local support groups where these children can grow up within a community and a strong sense of belonging. Malawi always had a tightly knit society. More than anything else, this has helped the country to get over the worst years in the HIV pandemic. So when Lighthouse set up local groups to support the many orphans living with HIV, it drew on these structures and reinforced them at the same time, making Malawi society even stronger. There are about 100,000 persons in Malawi who are HIV positive without even knowing. Finding them before they infect other people is the best way to curb the virus. To this end, Lighthouse staff regularly visit pubs in and around the city where men and sex workers meet. One by one, they are invited to visit the Lighthouse mobile lab to receive information on HIV prevention.
When they are here, the first thing is like the counselor welcomes them, he greets, welcomes them, then also assures them of confidentiality. I mean, they provide the basics of HIV, that is the mode of transmission and also prevention.
After receiving counseling on HIV prevention, the persons are offered to take a rapid HIV test. This is usually the moment when the situation turns tense, a moment of reflection and soul-searching. They understand that a positive test result would change their lives in a single moment. They have to confront their greatest fears. This young woman has decided to not get tested today, but she is taking the test home and has promised to do it there. The Lighthouse people can only encourage her and hope that she will do it for her own sake and the people around her. This man has decided to go ahead with the test. After 15 minutes of anxious waiting, he is presented the result. People rely on the fact that even if their test would have turned out positive, Lighthouse would provide them with life-saving ARTs. Another example of Lighthouse's outreach is the nurse-led community ART program. It is early in the morning. Lighthouse nurses get ready to visit a remote community. The nurses are going to Malembe, a suburb of Lilongwe, a mere 15 kilometers away. But it takes off-road vehicles and over 2 hours to get there.
As you know, transport is very expensive. So with that, then we thought that it's better that we come here instead of them coming to the facility. So it's us as a clinic that comes here with the medications that are required and give them to the clients right here in the community.
Those clients who are too sick to pick up their ARVs at the outreach clinic are being tracked and visited at home. But there is also a small number of clients who have decided to discontinue their treatment. Lighthouse teams will visit them and explain why it's so important that they regularly take their medication, even if they feel healthy. No one is left behind, and this is true for anywhere in Malawi.
Lighthouse has 5 sites where we are operating from. We have here where we are at Lighthouse Kamuzu Central Hospital. We have Martin Prose Center. Both these sites are in Lilongwe. We have Umodzi Family Center in Blantyre. We have Tisongane Clinic at Zomba Central Hospital. And then we have Rainbow Clinic at Nzuzu Central Hospital. In all these sites, we are seeing over 135,000 clients that are currently alive and on treatment.
Kamuzu Central Hospital in the north of Malawi serves a population of over 2 million people. Next to it lies Rainbow Clinic, which is still under construction.
So once the Rainbow Center of Excellence, which is being supported by Lighthouse, is completed, it will be beneficial to the clients because more people will access services, because currently the capacity is small. And once it's finished, it will increase the capacity. But overall, confidentiality, which is currently being compromised, will improve, and that will retain more clients into care.
Hopefully, Rainbow Clinic will be completed soon. Even then, large parts of Malawi's north will be hard to access, especially during rainy season, when roads become impassable. But the people of Lighthouse will continue to do everything in their might to provide life-saving HIV health care to their clients, however remote they may be. In the last 20 years, Lighthouse has succeeded in improving the general HIV situation. AIDS is no longer the main cause of death in Malawi.
By 2020, the Malawi program of HIV has reached what they call epidemic control, which is that the number of deaths and the number of new infections have significantly reduced, and they are well low below.
The new numbers are getting lower and lower, which is a good sign, and this is what we want to see.
Lighthouse has been the champion of the fight against HIV in Malawi. It started off small at Kamuzu Central Hospital with a group of volunteers, and then expanded to the current premises. And then with time, it became the center of excellence for the care of HIV in Malawi. And everybody in the HIV field in Malawi knows about the Lighthouse.
But with all its impressive success so far, what lies ahead may turn out to be an even bigger challenge.
I mean, one of our key concerns from Lighthouse, and this is a concern for the broader Ministry of Health, is about the overall sustainability of funding to the massive needs in the health sector. You know, we have more than 1 million people on ARVs. You know, they will need to be on ARVs for the rest of their life. And total funding from the donor partners it's stagnating, and it's projected to decline. There is limited scope for the government of Malawi to increase funding unless it significantly increases economic growth and broadens the tax base. But that's one issue that keeps many of us awake at night is will we be able to continue to sustain the quality healthcare that we're currently delivering, but for the next 2 decades, 3 decades, 4 decades.
But now with the issues of non-communicable diseases, we still see that we have a lot of work, because most of our clients are also presenting other health-related issues that are non-communicable in nature, such as the hypertension, high blood pressure, diabetes. So we still have a lot of work to treat all these ailments alongside treating HIV.
The HIV still is a huge problem, and I think we are getting closer to getting control of that epidemic, and the problem seems to get smaller on the attention and on the scale, but it is not over. And if we stop supporting this, I think it will quickly come back and be a major pandemic again, like it was maybe 20 years ago.
In the last 20 years, Lighthouse, in collaboration with the Ministry of Health, has helped to improve the general HIV situation. What lies ahead may be uncertain, but there is a reason to believe that the war against HIV can be won.